Jesse Hidalgo here with Hearing Group again. Joining us today is Janet Colley, so we're happy to have you. Thank you so much for joining us.
Thank you.
So one of the subject matters that oftentimes comes up with our patients when we are working with them in practice is a comment that they make. What is that comment that we oftentimes hear at the end?
How thorough our testing is. You know, we look in people's ears every time before we do any kind of testing to make sure that there's not any disease process going on, that the eardrum looks good, and most importantly, is there any wax in there that needs to be removed before we do a hearing evaluation. And then we do a comprehensive evaluation, air conduction, bone conduction, as well as word recognition score, which is very important. And then just go over all the details with the client, make sure they understand their hearing loss and our recommendation for their hearing loss, their lifestyle, and their budget.
So let's break it down just a little bit. One of the things that we generally start off with is what?
Video otoscopy.
It is, right? So
Right.
video otoscopy.
So basically we take an otoscope, which is an instrument that's used to look inside the ear. And what's wonderful about ours, it's a video otoscope. While I'm looking in there, you are going to be able to see it as well up on a big TV screen.
And what are some of the things we're looking for? I think you touched on it. We're looking for too much wax, any types of deformities of the ear, any types of breakdowns or a perforation in the eardrum, maybe any type of disease, maybe fungus, anything like that.
That's correct.
And then you talked a little bit about our hearing evaluation. And so the nice thing about that, you said we're very thorough. We give a very thorough test. Why do we do that, by the way?
Because that makes sure that the hearing aid is going to fit your loss. We program it based on that audiogram. And so if I don't have a thorough test that matches exactly to what your loss is, then I'm kind of shooting in the dark to get the correct amplification. So there's a lot of checks and balances in there too. When we get the test, we do something called speech reception threshold, and that gives us a check and balance. Is our test right? Does it match up against some of the other numbers that we do? So it's kind of a complicated process, but in order to get a thorough, perfect, not perfect, but on target fitting, you need to have a comprehensive test.
Again, thank you for joining us, Jesse and Janet with Hearing Group.